everyone. So today is part 5 on how to study in medical school, the step 2 CS. So I'm going to quickly go over my advice on what I did to pass the CS. So the first thing is I purchased the First Aid for CS. It's an amazing book. I got that, and I also got the Kaplan Practice CS as well. So what you want to do is realize that when you are taking the actual CS exam, the standardized patient is not going to tell you, oh, I have colorectal cancer or whatever. They're not going to tell you the diagnosis. Basically, what I'm trying to get to is they will give you signs and symptoms by the questions that you're asking, right? So basically what I did was for the First Aid CS book, all the cases, I ended up making an Anki deck of the signs and symptoms. And then on the other side of the deck, I wrote the potential differential diagnosis. So let's take an example because I'm looking at my Anki deck right now. Let's go here. Okay, amenorrhea, galactorrhea, visual field defect, and headache. So this is what the patient comes in for, saying, I haven't had my period. I noticed there's some discharge from my breast, and then I'm also having problem, seeing things, and I have a really bad headache. Okay, whatever. So this is what they tell you. So then, what are your differential diagnoses? One is amenorrhea secondary to prolactinoma, pregnancy, thyroid disease, premature ovarian failure, pituitary tumor. So these are your differentials, right? And then what further management would you do? So you do pelvic and breast exam, a urine HCG, LH, FSH, TSH, prolactin, and MRI of the brain. So I basically took the cases and then I just made the symptoms on one side of the card and then the differentials and then further exam on the other side. So let's do another example. So let's say they come in, they're like, I feel like my heart's racing fast, like palpitations, I'm just sweating so much, so diaphoresis. So what are some possible differentials, right? So you have hypoglycemia, arrhythmia, angina, and then hyperthyroid. So what is the management? What else would you do? So you check their glucose, you get a CBC, check their electrolytes, TSH, and get an EKG. So you do see like what I'm saying, like when you take these cases from your first aid book or from the Kaplan book or from whatever CS books that you have, just know that you're going to walk in with, symptoms that are going to be told to you by the standardized patient or shown to you by the standardized patient. And you have to take that and come up with differential diagnosis. So let's take one more because, I'm having too much fun with this. Let's say, okay. Let's say someone comes in saying, I'm really nauseous. I've been vomiting. I just recently had, a cold, so maybe an upper respiratory infection, whatever, and I've been just so dizzy. So what are some differentials for that? So you have the vestibular neuronitis. That's one. Okay, no, that was a bad example. Just kidding. Let's try another one. Sorry, guys. Let's say there's a memory loss and there's gait disturbance and urinary incontinence. What are you thinking of? Normal pressure hydrocephalus, right? So things like this. So that's what I did. I took the signs and symptoms and then I just made flashcards out of them. So whenever I walk into the room, it's like, okay, you're telling me these symptoms, sounds like A, B, and C, whatever. These are my differentials. And then on top of that, what you need to do is decipher between the differential diagnosis by asking questions that are specific to each of the diagnoses. So you know which one to put as a primary, most common, most likely diagnosis from the least likely diagnosis, right? So that's what I did. So I got those books. I read it. By the way, I only had 2 weeks to do my CS exam. So that's what I did. My next advice is if you can take a practice CS from whatever company. So I did Kaplan practice CS. I'm not endorsing any company, nor am I getting any compensation. So I just want to throw that out there. I did the 1-day Kaplan practice test, and I am telling you, do it, purchase it. It's worth it, guys. Just do it, okay? If you can get that, if you can go and practice, I actually wanted to cancel because I was lazy, but I'm so glad that I went in. And this is also from my peers that agreed that they're so glad that they took a practice exam because they also passed the CS. So my school actually had a discounted fees. So it was about like a couple $100 and whatever. So I went, took it. I did pass it, but I mean, there were a lot of constructive criticism for me to improve and just so I'm more confident on the day of the exam. And I can tell you now, I felt the Kaplan practice CS was actually harder than the actual CS. So definitely it is worth it. Save money and see if you can go and take the practice CS test. So that's my second advice. My third advice is practice your physical exam. So what I did was, since I only had 2 weeks for the CS, I YouTubed all the physical exams, all the OSCE physical exam, just so I can get a visual and watch how their techniques are. So I did that. Secondly, I also read. My school gave me a PDF of the physical exam. It wasn't that long. It's not a very long PDF, and it's amazing. I still have it, and I'm always going to use it. Love that PDF. It's great. And then also what I did was I actually practiced physical exam on my sister. Love my sister so much. Thank you to my sister for helping me out here. Practiced on her. And then I also practiced on my classmate who is also gonna, who was planning to take her CS. So, since she knows the techniques and, also has been practicing, she also helped me and gave me some constructive criticism as well as some feedback. So, which helped me a lot. So I did that. I YouTubed, I read, and then I practiced. So on the day exam, I was very comfortable with the different maneuvers that I had to do. Okay. Another advice I have, number 4, is whether you're studying for the CS or the CK, kill 2 birds with 1 stone. How? Okay, let me give you an example. Let's say you're studying for the CS and now you're looking at a case in first aid or whatever book that you're using, and it's about headaches, right? So you'll read whatever the CS book says about headaches and what are the signs and symptoms and whatever. And then what you'll do is go to your CK book that you're using for reference or up to date or whatever method you're using to study for your CK and read about headaches there. So it's like you're studying for the CS, but you're also studying for CK because you're combining both together, which is amazing because it's more ingrained in your brain because you're looking at both sources, okay? So those are some of the advice I have. Now, so the day of the exam, okay, so let me give you some tips and pointers on the day of the exam. So this is something that I've always been doing since like my 3rd year. So this just came like, second nature to me. What I do is before I go see a patient, I get a blank sheet and I kind of write my mnemonic on there so I know I don't skip anything. I don't forget something. So this is my my mnemonic that I have. It's called CHP MASSFR. So what does all that stand for? So the C stands for chief complaint. H is for history of presenting illness. P is past medical history. So CHP. M is the medications that they're taking. A is the allergies. S is the social history. S is the sexual history. Then F is family history. And then R is the ROS. So CHP MASSFR. So I would write that on my sheet of paper, and I even did this on the day of my CS. When I was standing at the door, I wrote that on the left-hand corner, just down the sheet, down the paper. My mnemonic, and on the top right-hand corner, I put the name of the patient because I would forget, honestly, because I would be so nervous. I wrote the name of the patient, their vital signs, their age, and their reason for coming in, the admission or whatever. So that's what I did. So it was just easier because it kind of gave me this sense of relief, because in case if I do forget something, it's like I could just look at my notebook on my sheet, excuse me, and there it is. Then I can ask the next question. So have some systematic approach, and use that consistently, because then it stays in your head. Now it's like I don't really have to write it down. It's like I know it's in my head, so I don't have to worry about it. So get some sort of a method, some approach to doing your history and physical. Let's see, what else can I say? Smile, guys. Oh my God. I gotta tell you, you have, like, just smile. Like, it's not just about how much knowledge you know, but it's also, like, are you human? Like, are you smiling? Are you shaking their hand? Are you giving them your undivided attention? Are you calm, composed? Are you, the way you're sitting? Are you slouching? Are you tense? Like, get it together, guys. Like, it's cool. Like, relax your shoulders, meditate before, whatever. Listen to, music that gets you going. Like, you got this. You absolutely got this, guys. It's practice makes perfect. And I've been preaching that. Practice it, visualize it, do it. You will be fine. Like, I felt that, like I said, the Kaplan was harder. The Kaplan practice was harder. Even like the OSCEs in school was harder. So, it was fine. The day, after I was done, like, yeah, I mean, obviously I was nervous and whatever. And I did forget a few things. Like, I forgot some physical exam maneuvers, and I'm just like, I can't believe I forgot that. Like, that's the most important one. But it's fine. I passed and I did fine. Okay, so what else do I need to tell you? Oh yeah, so multitask. So what do I mean by that? So you knock on the door, you go in, you smile, you introduce yourself, you ask if they're Mr. So-and-so, and then use the hand sanitizer. So you need to be multitasking because you're on a time constraint. So as soon as you walk in, you're talking, you're doing. So you're talking, you're using the hand sanitizer, because that's a point right there. And like, you're actually showing them, like, you're using the hand sanitizer. Like, be very obvious, okay? Super important. Same thing with physical exam. As you're doing the physical exam, talk to them like, okay, now I'm going to listen to this side of your chest. Now I'm going to listen to this side of your chest. Can I get you to do a big, deep inhale? Now exhale. Okay, now I'm going to go to the back of your chest, and I'm just going to do a little bit tapping. Let me know if I'm hurting you at any point in time. Talk and do, because you are on a time constraint, okay? Super important. Know your ROS inside and out, because I know there's so many parts of the ROS. Like, keep reviewing that as well, and start from head to toe with your ROS, okay? One thing that I did was, like, I would joke with my patients, because you know what? Like, you're already in such an environment that you're tense, you're nervous, you're scared, because you're like, okay, if I don't pass this, like, I would have to take it all over, and you have to wait like months at a time or whatever to reapply, and then you miss your interview cycle and whatever. It's okay, guys. Just breathe, take it easy, be nice. If anything, if you don't know the differentials or you're stuck, just be nice. At least, because they're grading you on each of the different parts of the exam. Okay. Let's see what else that I could tell you. I actually took my CS in Los Angeles, and they were super sweet. The proctors were super nice, and they were also joking with me, and I was joking with them. Like, like I was just trying to make the most of it. So I did in LA. You just had to bring your ID and your stethoscope. The food was provided by them, but I also brought some snack just in case, because I eat when I'm like stressed out. And I think that's it. One more advice that I have is go on usmle.org website and read about the Step 2 CS. Know it inside and out, what they're saying. They also have practice materials. They also have some sort of a link that I saw earlier about common signs and symptoms and stuff. So see, like, even they're like telling you, like I'm looking at it right now, it says Step 2 CS announcements, Step 2 CS cases, common presenting signs and symptoms. See, right there, guys, they're telling you these are some common signs and symptoms. So like, it would behoove you to like do the same, right? Make your Anki deck of here are the signs and symptoms that I might encounter. What are the differentials? What are the next step in management? Like that's like most important, because or else you're stuck. You're like, I don't know why, you came in with, I don't know, what can I say? Pain in your finger, whatever. Like, I don't know. Like you need to know what you're dealing with. You need to know what these signs and symptoms mean, right? And then also lastly, if you want to get like a lot of points on your CS, when it comes to typing your H&P, use medical jargon then. Don't use it with the standardized patient. You're gonna lose points on that one. But when it comes to like you're actually typing up your H&P, use the medical jargon. Show that off. Show what these big words that you learn in med school. That will get you really, really far. Besides that, guys, look at the website usemily.org. Invest in getting some CS book, whatever works for you. Practice signs and symptoms and what the differentials are and what the managements are. Find someone that is willing to put up with you practicing on them. And then you know what? Just take it easy. There's 12, I think there's like 12 rooms, if I remember correctly. It's okay, guys. It's okay. You will do fine. Besides that, that's all I have to say. I hate making long videos, so this is about it. I also have a blog, so whatever I talk to you about is also on the blog. And I have an Instagram, so follow me on Instagram, Facebook. Reach out to me if you have any questions, you need help with anything. I got you. And good luck, guys. Take care.